Hello and welcome. Today we're going to discuss a rare congenital condition called Epispadias. This condition involves a malformation of the urethra, the tube that carries urine from the bladder out of the body. We'll explore what causes it, how it affects the body, how it's diagnosed and treated, and what the long-term outlook is for individuals with this condition. The exact cause of Epispadias isn't fully understood, but it's primarily considered a birth defect that arises during the early stages of fetal development. It occurs when the urethra doesn't close completely during gestation. Genetic factors may play a role, and it's often associated with other developmental abnormalities, such as bladder exestrophy, where the bladder develops outside of the body. While there's no single, definitive cause, it's generally believed to be a multifactorial issue involving both genetic and environmental influences during pregnancy. In Epispadias, the urethra opens on the upper surface of the penis in males, rather than at the tip. In females, the clitoris may be split, and the urethral opening may be located further forward than normal. This abnormal urethral positioning can lead to a variety of issues. Because the urethral sphincter muscles may also be affected, urinary incontinence is a common complication. Additionally, the abnormal position of the urethra can impact sexual function and fertility in both males and females. The severity of these effects varies depending on the degree of urethral malformation. Epispadias is a relatively rare condition. Estimates suggest that it occurs in approximately 1 in 100,000 males and 1 in 500,000 females. It's often seen in conjunction with other congenital abnormalities, such as bladder exstrophy, which further complicates the epidemiological picture. Because it's a birth defect, there aren't any specific risk factors that can be avoided during a person's lifetime. Accurate prevalence data is difficult to obtain due to variations in diagnosis and reporting. The signs and symptoms of Epispadias can vary depending on the severity of the condition and the sex of the individual. In males, the most noticeable sign is the abnormal location of the urethral opening on the top of the penis. This can be associated with a shortened penis and curvature. In females, the clitoris may be split and the urethral opening may be abnormally positioned. Urinary incontinence, or the inability to control urination, is a common symptom in both sexes. Other potential issues include urinary tract infections, sexual dysfunction, and fertility problems. Epispadias is usually diagnosed at birth or shortly thereafter during a physical examination. The abnormal location of the urethral opening is typically readily apparent. Further diagnostic tests may be conducted to assess the severity of the condition and to rule out any associated abnormalities. These tests can include ultrasound imaging of the urinary tract, cystoscopy to visualize the bladder and urethra, and voiding cystoarthrograms, which X-rays to examine the bladder and urethra during urination. Genetic testing might also be considered, especially if other congenital anomalies are present. Epispadias is generally classified based on the location of the urethral opening. In males, it can be classified as penile, where the opening is along the shaft of the penis, penopubic, where the opening is at the junction of the penis and the pubic bone, or complete, where the urethra is open all the way to the bladder. In females, the classification is often described by the degree of clitoral splitting and the location of the urethral opening relative to the clitoris. These classifications help guide treatment decisions and predict potential complications. The primary treatment for Epispadias is surgical correction. The goal of surgery is to reconstruct the urethra and reposition the urethral opening to its normal location. This can involve multiple procedures and may be staged over time. In males, surgery aims to create a functional penis with a normal appearance, while in females, it focuses on reconstructing the clitoris and ensuring proper urinary function. In addition to surgical correction, ongoing management may include medications to control urinary incontinence, physical therapy to strengthen pelvic floor muscles, and psychological support to address any emotional or social challenges related to the condition. Unfortunately, there's no known way to prevent Epispadias, as it's a congenital condition that arises during fetal development. Prenatal care is important for monitoring the overall health of the developing baby, but it won't prevent the occurrence of Epispadias. Genetic counseling may be helpful for families with a history of birth defects, but it can't guarantee that Epispadias won't occur. The prognosis for individuals with Epispadias varies depending on the severity of the condition and the success of surgical correction. With appropriate treatment, many individuals can achieve urinary continence and satisfactory sexual function. However, some may require ongoing management for urinary incontinence or other complications. Recent research focuses on refining surgical techniques to improve outcomes and minimize complications. Additionally, researchers are exploring the genetic factors that contribute to Epispadias. which could potentially lead to improved prevention strategies in the future. The long-term outlook is generally positive, especially with early diagnosis and comprehensive medical care.